also, okay? And then after 12 weeks, that's actually the acute phase. And you will simply manifest, okay, flu-like symptoms rather, okay, flu-like. Then um, the body continues fighting the virus, okay? T cells at this time, okay, is being attacked, okay? So little by little, okay, T cell counts decrease, okay, specifically CD4, all right? And then in between, prior to the full-blown AIDS is actually the latent period, okay? But it's already part of the chronic phase, all right? And then when the number of T cells, okay, reach a certain level, then you will have full-blown AIDS. Okay, so depending on the how strong the immune system of the person infected, okay, so full-blown AIDS can manifest after 2 years, after 4 years, 5 years, 10 years, some, okay, 15 years. Okay, so anyway, so these are just some of the description, okay, general description of acute and chronic phases. Okay, so in here, okay, so look at this. During the chronic phase, virus continually increases and then T cells decrease. Okay, so some have this specific X4 strain, but not all patients, okay, infected with HIV have this. And this X4 strain, okay, so let's go to the next slide, okay. So it's still being attacked, okay. So again, no, not present in all patients, but this goes to the lymphoid tissue. That's why some of our patients, okay, many actually, some, okay, so manifest with big lymph nodes, okay, lymphadenopathy. And further on, okay, compromise the immune system. All right, so at 200 to 500 T cells level, okay, these are the expected signs and symptoms. Okay, if the level of the T cell CD4 count, okay, specifically, okay, of the patient infected with HIV, so you will see very commonly lymphadenopathy, okay, swollen lymph nodes, and then hairy leukoplakia. Okay, so leukoplakia, okay, is another infection actually, okay, caused by another virus, okay, the Epstein-Barr virus. Okay, remember, no? Okay, people living with HIV compared to the immune system of a normal individual, okay, is very low, thus very susceptible to other infections. And then fungal infections, specifically oral candidiasis. Maraming singaw, okay, kaya madami silang singaw. All right, so we had a patient in a school before, okay, so he presented with recurrent, okay, singaw, okay, so palagi nagpupunta sa dentist. All right, so and then later on, we asked him if he wants to have a screening for HIV, okay, so and it turns out it was positive. So anyway, so less than 200 T cells, then severely, okay, your immune system is compromised. So this is the time manifestations of full AIDS, okay, will start. Okay, so there's persistent fever, fatigue, weight loss, diarrhea, okay, and if you have tests specifically looking at the viral load, okay, we don't have yet, I think, that in the Philippines because we don't have yet a virology institute, okay, so it will be found out that HIV in blood increases significantly. Okay, so these are the AIDS defining conditions. Okay, so recurrent bacterial pneumonia, and mind you, the bacterial pneumonia that they have is not easy to treat. Okay, and aside from that, it's recurrent. Okay, if the patient be treated with pneumonia rather in a month's time, okay, after 6 months, he's free. But then pneumonia comes back, okay? So it's recurrent. And then, of course, fungal infections, okay, candidiasis, okay, candida is the culprit, okay? It's not just the oral, okay? It also goes to some systems like esophagus and then even the nails and even the skin, okay? So, mabalakubak sila, okay? Mabalakubak and then medyo scaly talaga yung skin, very dry, okay? And then also many or some, okay, a portion of people living with HIV develops sarcoma, tumors, okay? Very common, Kaposi's sarcoma, okay? In the Philippines, it was not here because this slide is Western, okay? So, in the Philippines, the most common, well, one of the most common causes of death of people with AIDS is actually TB, tuberculosis, no? It's hard to treat, all right? And then, okay, so transmission, okay, this is again a Western slide, okay, so but more or less, um, we see that in the Philippines it's also true, okay, so 75% still sexually transmitted, no? I mean, the mode of transmission is through sexual intercourse, no? Very specific, pinakamadami pa rin ang MSM, okay, male having sex with male, homosexual, okay? So, not just in the US, also in the Philippines. You will see that in one of the slides. And then male to female, yes, there is also, okay? And then female to male, meron pa rin. If the female has HIV present in the different fluids, all right? And then, okay, so this is very important, no? The intravenous drug abuse, okay, the users, okay, they're becoming significant in transmission of HIV, okay? And then also, a very small percentage is the vertical transmission. Vertical is the mother to child, okay? So, kaya siya vertical. Okay, and then accidental needle sticks or pricks, okay? So, these are some of the medical errors na babawasan na. And then transfusion, blood products. Okay, so in the diagnosis, we have screening. Okay, so recommended first antibody antigen test. Okay, and if a patient who availed of this test becomes positive, there has to be confirmatory test. Okay, so may second test. Hindi pwedeng yung first test lang. So always with confirmatory test. So either an antibody test or the RNA-DNA test. Okay. And then there's already treatment. Okay, just I think this is not uncommon to you. Okay, the ART, antiretroviral therapy. Okay, which was also part of the medicines which were being tested against COVID, no, COVID-19. Okay, so anyway, the antiretroviral therapy has to be clear that it does not cure. Okay, so it does not cure. So what happens? It treats. So it delays. Okay, it slows HIV replication. It does not stop HIV replication, but it slows HIV replication. And definitely improves, okay? Help improve the immune system and ergo, the ability to fight, okay, infections. Yan. So it helps a lot of people living with HIV. This is to at least delays, no? Sometimes it delays the full-blown, okay, AIDS. And if you already have AIDS, okay, may full-blown ka na, okay, some, okay, shows improvement in the way they fight opportunistic infections. Okay, now, AIDS as a public health concern. What is the current situation and what have been done so far? A lot have been done actually, Okay, so look at the summary of the global HIV epidemic. Okay, so let's just look at the estimated total. Okay, so this is the average of HIV-related deaths in 2019. Okay, so 690,000. Okay, but actually the deaths can range from 500,000 to 970 million. Okay, sobra namang dami nito. Okay, so um, I checked this out because I was a little bit confused. Is this million or is this thousand? And I think this is just thousand. Okay, 690,000. Okay. Um, if you compare it with the death now, global death secondary to COVID-19. So I just checked the other day. We're already around 800,000 global deaths secondary to COVID. So um, uh, it's still, no, the global HIV epidemic still is an epidemic. Okay. Okay, so let's see at how healthcare in of HIV/AIDS is. I mean, how is it? Okay, so that includes the HIV testing and treatment. Okay, so this is again global. Okay, the source is UNAIDS, WHO, and these are all estimates. Okay, so if we see here, okay, in the graph, people living with HIV, okay, around what, let's say 38 million, and out of that 38 million, only 81% is aware of their HIV status. Okay, so, paano nila nalaman yun? Eh, 40 million nga. There are probably some tests which were not which were not known to the patients for one reason or another. Okay, so 81%. And then out of that 81%, 67% are only on treatment. So medyo sana 81% din, no? If they're aware of the HIV status, or probably there are cases also which are still in acute phase. Ayan. So it depends. It depends on the decision of the doctor or the state of the health of the person living with HIV. Okay? And then out of this 67% being treated, well, 59% not bad, okay, shows viral load suppression. So therefore, ERT therapy, so antiretroviral therapy seems or, well, gives us a hope. Okay? So in helping people living with HIV. All right. So how about this one? Okay, I'm just presenting you some epidemiologic graphs. Okay, so globally, okay, so for men, 61%, so the ones who are undergoing ERT, okay, so, and then women, 73%. Okay, sa Southeast Asia, hindi ko na kinuha yung Pilipinas mismo. Okay, so look at it. It's 56%, 65% lower than the global, no? So it still can be improved. Okay, so these are predictions in the reductions in new HIV infections by child population. Okay, so again, no, these are all predictions. Comparing the current trend and the fast track scenario. Okay, so the fast track scenario, this was based on some goals of a collaborative effort globally. Okay, so ito yung gusto, kaya lang hindi ata nangyayari. Look at it. Current trend, so in this age population, 0 to 4, so this means at birth, nagkakaroon ng HIV, okay, or infected by HIV. Most commonly through the mother, okay, so vertical. And then age 15 to 19, they are already active, sexually active, no? Okay, so let's see. 2020, nandito tayo ngayon. Sa current trend, 42%. And then, fast track, 49%. So,
Okay,
hindi naabot. So, the goal of the fast track, okay, in reduction or in reducing HIV infections, okay, is 7% short. And now, we look forward, okay, 2030, hopefully, okay, no? Kaya lang, ang prediction pa rin ng current trend ay 75%. So is this, will this be a reality? Okay, no one knows yet. Okay, so, but with what we have now, medyo, sana, okay, sana. And then, okay, off track for fast track. So what happened 2020? Okay, so again, no, this again was a collaborative effort, private, government, and then global. So many countries. Okay, so they wanted to start free for population 0 to 4. Okay, so and then stay free for population 15 to 19 because these are active, I mean sexually active already. And then AIDS-free, wala pa. Kasi nga, pag hindi na control ang start free and stay free, then there will be no AIDS-free. Okay? So start free, the goal was 95% reduction, okay, by age 0 to 4. But what happened? Okay, only 42%. Even their fast track scenario didn't reach the goal, okay, the 95%. Okay, so very short of what? Around half. Okay, 50%. Okay, so how about the stay free? Definitely, medyo malayo pa rin. Okay, so 75% reduction. Okay, this time, they have to qualify the girls and the boys because by this age, they're sexually active already. So 28% girls, 25% boys. Napakalayo sa 75%. Okay, sa fast track scenario, 68%, 68%, but still didn't reach the 75% goal. Okay, so medyo malayo pa tayo, AIDS-free. That's why it's also now important to know this, no? That number one, there is a global effort, but then medyo short pa rin. Okay, but still, there is continuous effort. All right. Second, we have to accept the fact that AIDS is a public health concern. Okay, HIV and AIDS are is a public health concern. And as young as you are, doctors, you have to know how to deal with these patients. Okay, so anyway, okay, let's see. Okay, so why is it important to know the prediction among the young population? Okay, so ito yon. Okay, so this is an epidemic aging through the life cycle. So remember the acute and the chronic phase. So it takes what? 2 to 10 years, no, for it to have full AIDS. Okay, ano, full blown AIDS. Okay, so it is carried over rather, so across life cycle. That's why it's important to control the transmission of infection, okay, among mothers. Ayan. So sa bata, because they add to, okay, the across the life cycle. So 0 to 4, for example, this is carried over to, okay, to the future, okay? By then, they're already 15 to 19, but there is also a certain population during this time. So, nadadagdagan, okay? So, there. So, kailangan din talagang very important to control the ones with sa pediatric population. Okay, so this is just to show you some fast track strategy aims. Okay, so 1990, the age population 0 to 4, 5 to 18, and then 15 to 19. Okay, so sana 90% is being treated, 90% is being treated, 90% is being treated. Okay, new infections among adults, okay, 500,000 or lesser, and then zero discrimination. Tinias nila for 2020, 2030 rather, 95, 95, 95. Okay, new infections, hopefully bababa, and then zero discrimination. Those are goals of the fast track strategy. Okay, now, what is the Philippine scenario? Okay, how is healthcare for HIV/AIDS in the Philippines? Okay, so there is an effort. Okay, um, previously this was Republic Act 8504. So now it was reenacted, okay, by the President of the Philippines in 2018, becoming RA 11166. Okay, Philippine HIV and AIDS Policy Act. Okay, so I also shared with you the health sector plan, specifically of the Philippines. So it's good to read it. Okay, so 2015 to 2020. Okay, to know that or there's something. Okay, and there are strategies actually, actual strategies written. Okay, the challenge is, or the question rather, is are they being implemented? Okay, that's always the problem of um, our healthcare system. Okay, so we are talking about public, okay, government public health. Okay, so there are major strategies in that healthcare sector plan, okay, and as well as um, with the Republic Act. Okay, so strategy 1, 2, 3, okay, and 4. Okay, so our health department has aligned, okay, their goals, okay, globally. Ayan, to achieve global targets of zero new HIV infections, zero AIDS-related deaths, and zero discrimination. How? Through cost-effective interventions, okay, ensuring universal access to prevention, treatment, care, and support. So medyo malayo-layo pa tayo. Medyo madami. This is really an issue. Okay, look at this. This is important, no? 1984 to 2007. Okay. So probably we can say that the HIV/AIDS awareness during these times was low. Okay. So blood transfusion ang the main mode of transmission, okay, during this time. But look at this, the homosexual relationships, this is MSM, okay? So male having sex with male, okay, is already significant, about 1/4. Okay, and then bisexual, okay, is also there, but not that uh, big chunk yet. Okay, so and then needle prick. Okay, so errors, medical errors, so meron pa rin, and then look at this, the green one, the intravenous or the drug users. So maliit pa nun that time. And then heterosexual there is. Okay, so after some time, after efforts of education on public health education on HIV, AIDS, etc., okay, and then there was an effort to really control blood banks. Okay, I think in high school then, when different blood banks. Actually, madami tayo noon. Along Moraita, Bambang area, okay, there are a lot, business yon, blood banks. Okay, so maraming nagbibenta ng dugo, okay, and then it became a business. That's why during that time, pinasara yan. Kaya nakita natin, ang laki ng decrease. Okay? So, it's not just AIDS, but also Hep B. Kaya pinasara yung mga blood banks na yon. Okay? So, it decreased. But, what happened to the homosexual? Okay? So, the MSM, dumami. And then, also bisexual. Okay? Nakikita natin tong green, yung IDU. Okay? So, dumadami na rin sila. Okay, so lumiit na yung proportion ng mga medical errors, needle prick, etc. Okay, so what does this pie chart, okay, say? Okay, so it's up to you. It's up to you to think, no? That despite awareness, ang titigas ng ulo. Okay. This is a summary of the Philippine HIV epidemic. Okay, read through it. Okay, and then these are the ethical issues. I will finish in 5 minutes. Okay, so confidentiality. very specific, Section 44 of RA 1116.6. Disclosure of confidential HIV and AIDS information and or media disclosure. Okay. Always unethical, unlawful still, okay, to disclose without written consent. So it's a crime against Cybercrime Prevention Act of 2012 and Data Privacy Act of 2012. Okay. However, there are exceptions. Okay. So these are very important. You have to know this. Okay. Not just for the exams, but until you practice medicine. Okay. First, when complying with reportorial requirements, okay, set by the National Active and Passive Surveillance System. So, including reports of death of the DOH. However, we have to be very careful, okay, with the information. So, only those who need to know should know, okay? So, person's identity shall remain confidential only, okay, confidential publicly, okay? But for those who need to know, workers directly involved in the treatment of or care of people living with HIV. So this is not unethical, provided that okay, the duty of shared medical confidentiality is observed. Okay? Hindi yan pinagchichismisan. Only those who are directly involved in the care, okay, and treatment of PLHIV, okay, should know. Okay, should know this information. Okay. And they cannot talk about it. Okay, among other healthcare workers who are not directly involved. Very important. Okay, and then C, when responding to a subpoena duces tecum and subpoena ad testificandum issued by a court with jurisdiction over a legal proceeding where the main issue is the HIV status of an individual. But, okay, two things have to be taken care of. So again, no, dapat yung record na yon anonymous and unlinked. And, okay, the ones who are involved in that court hearing, okay, should take care na sila lang. The hearing should be in an executive session. Okay, that's how we guard the confidentiality of the report of anyone who have HIV. Okay, disclosure of HIV-related test results. Okay, so anyway, this will be tackled again in Pedia, but it's good to know it now. Okay, so below the age of 15 years, an orphan or suffering from mental incapacity or in comatose state, of course, the result can be disclosed to the nearest of kin or legal guardian or duly assigned licensed social worker or health worker, whichever is applicable. Okay? So, for a person below the age of 15, because he already knows right and wrong, okay, it should be taken note of that um, the consent, okay, to undergo the test for HIV should be voluntary. Yan. So, dapat informed and voluntary yung consent. Okay? Autonomy. Okay, so never compulsory HIV testing. So, even if it's a requirement to employment, for release of benefits, travel, school or hospital admission, or access to medical services, it is prohibited by law. Okay, so walang compulsory HIV testing. Okay, so unless, anyway, so in principle, hindi yan talaga pwede. Okay, and it becomes ethically illicit when decision, okay, to have HIV testing, okay, was arrived at without proper information, full disclosure, and counseling. Okay, so full disclosure of what? Okay, kung anong mangyayari, paano gagawin yung procedure, okay, what is it for, etc., etc. Okay, so, and then there is a pre-screening and post-test counseling. Kasama yan, even in the Philippines. Okay, beneficence. So both means and end are focused on the welfare of the patients or clients. Okay, so the document that I ask you to submit, what's that? Yeah, your assignment. Okay, so nakalimutan ko na. This is on the research on vaccine, no? Okay, so, but anyway, one of the researches being done actually for AIDS, HIV, is animal studies. Ayan. So, because you cannot use humans yet because this is a very controversial issue, no? HIV and AIDS. Okay. Even actually any STD, okay, for that matter. Okay. So, example, why did I give this as an example? Okay, so high risk of using animal studies, okay, for biological warfare. Okay, so what do they do here? Usually, the most common thing for animal studies for HIV and AIDS is to bioengineer a mouse or mice. Okay, so these are called SCID, severe combined immunodeficiency mice. Okay, so yun lang yung issue. This is just the issue raised. Okay, so yeah, so there are the research might give us good results, etc., but it is prone to abuse. That's why there are still debate whether or not um, this should be continued or what, okay, or withdrawn. Okay, non-maleficence, always do no harm. Okay, and there's always a caveat, no? It's not just do no harm. Okay, so it's actually weighing, okay, good benefits from non-benefit. Okay, so both for the patient and for the healthcare professional. Okay, so there are also cases, okay, which you will see later on, that healthcare workers, okay, are infected with HIV. So do they have the moral obligation, or out of professionalism, they have to reveal their status to their patients? Yan. So that's a question, okay? And then, so no to discrimination in all places. So we should be empathic, compassionate, and show social support. Justice. So, of course, no, each one should have access to information, testing, treatment. Okay. So, for now, these are my references. If I still have other documents for you to read, I will give it to you through Moodle. But if none, then we will focus on the resources given you in the Moodle. Okay, so you will have a very short quiz, super easy. If you've actually yeah, you've listened in that, so you the email directly. Okay, so you have 8 minutes. So those who will pass the exam 301 and above or later will not be considered. Okay, so there are only 5 points.